The obstetric anesthesiologist has seen a patient that looks like this. This is a patient who is suffering with a post-dural puncture headache from an epidural. I hate that it happens, but it does. She's about to get a blood patch, which is the only definitive treatment for this type of headache. A blood patch procedure typically involves 2 anesthesia providers when possible. One will draw blood from the arm while the other will work at the back of the patient to place the epidural needle. Blood is drawn in the usual way, except it's done under sterile conditions, so that means prepping the skin and draping the area first. About 20 milliliters of blood is drawn. Simultaneously, the patient's back is cleaned and draped as usual with an epidural placement. The skin is numbed, the epidural needle is inserted, and the epidural space is identified. Once the epidural space is reached, instead of placing a catheter through the epidural needle as we would usually do in order to give medication, instead we inject that sterile blood slowly through the epidural needle. The goal is to inject all 20 milliliters of blood, but if the patient develops significant lower back pain or pressure, then the injection is stopped. Then everything comes out of the patient's back and the patient will lie flat for about an hour. Usually the headache gets much better almost immediately. The biggest downside is that it's pretty common to have low back pressure for a couple of days.